We're back with Dr. David Klein from the Stages of Life Medical Institute. Now, today you're talking to us on behalf of Florida Laboratory Analysis, and they've got some amazing stuff I've heard in the world of DNA analysis. Now, what is DNA analysis? Is that just that who's your ancestor type stuff they see on TV?
No, well, we can do that too.
Ah.
Okay, what this is all about, okay, is a step up, if not 2 or 3 steps up with regards to the delivery of healthcare in this country. DNA analysis has been around a long time, using a technology called PCR, which involves replication of DNA from whatever source. You can then identify, you can select, you can then treat your patients more precisely once you know what the heck you've got. Now, traditionally, what we've done with our patients for infections is we'll do what's called a culture and sensitivity. Now, we all know what that's all about. You do a swab, you do an aspiration, you do a scrape, and then you send it to the laboratory where it's placed upon an agar plate or similar, and then it grows over a period of time, anywhere from 2 or 3 days to 6 weeks for things like tuberculosis, slow-growing organisms. That's the way we've done it in the past. What you may not realize is the inaccuracies that are involved for a number of reasons. One of which is what and how is the sample handled? We take a sample from the patient, from the clinical situation, whether it's a nursing home, whether it's home health, whether it's a hospital, doctor's office, it doesn't really matter. It could be done in the field for that matter. And that sample is then sent in a little tube, a little clicker thing that stabilizes it, off to a lab which might be around the corner, might be on the other side of the country, depending upon the situation. What you may not realize is that certain samples need to be kept at body temperature in order for them to actually give you what you need. And what this does is it leads to false negatives. You know the patient's infected, but you can't figure it out. Why is it that it takes 10, maybe 12 blood samples to find a positive blood culture? Now you know the patient's septic, yet you may be looking at 10, 12, 14 tubes before you find one that's positive. You know you got a problem, patient is sick, they're dying, whatever, and now you're having to fight with your laboratory. Well, the answer is very, very simple. When you have to be looking for high levels of bacteria in order to grow them out, because most of the bacteria will be dead by the time it makes it to the lab for culture, you're going to lose most of the time. Same thing is true of urine. You know, you go ahead and you got a patient with an obvious urinary tract infection. You can see pus in the urine, white cells. You might even be able to see the bacteria on microscopy, but you can't culture it out. Stool samples, very much the same thing. With a stool sample, most people don't realize that for a stool sample to be accurate, it actually has to be warm by the time it hits the lab. That's like a pizza delivery time here. Okay? Now, you get a pizza delivered to your house. It may take 9 to 15 minutes to get there. If it's cold, it's not a good pizza. The same thing is true of stool samples. So what you do with DNA analysis actually is you take all of that out of the equation. You take out the 3 to 6 day wait. You take out the inaccuracies, the insensitivities, the lack of specificity, and then within a matter of hours, you can actually know what is bothering your patient. Now, this is kind of critical importance when you're dealing with close quarters, whether it's a jail situation, whether it's home health, whether it's a hospital, where you can take one person. You know, the problem with hospitals is it's filled with sick people, right? Okay, the problem with nursing homes is they're not healthy, particularly either. So you know they're ill, okay, or they have a 30 to 40% chance of having an illness that's being incubated, and they pass it on to the staff, who then pass it on to the other patients that are floating around. That's just the way that it goes. With DNA analysis, you can know very, very quickly precisely what the bug is, whether it's viral, whether it's parasitic, whether it's bacterial. So with certain DNA technologies that are available now, you can have this done very inexpensively. It's really, really neat, and it's changed my practice. Stages of Life Medical Institute is located in Florida, Longwood, Florida, central part of the state. What's interesting about it is we were the first doctor's office in the world that introduced this into the office setting. Why did we do that? Well, I'm kind of a tech geek. I like to be able to look at new technologies, evaluate them, master them, and then move on to something else. So we did this with gastrointestinal, we did this with respiratory illnesses, and it makes a difference. When somebody comes in and they are sick, okay, we can go ahead, do a nasopharyngeal swab. That's a little tiny test tube brush that you slide up into the nose. It doesn't feel anything. It tickles as much as anything else. And then you pop it into the tube, run it through the machine, and an hour and a half later, you have an answer. Okay, if you're doing nothing else, you can get it done in 50 minutes. Okay, so it gives you the answer in real time. Gastrointestinal, exactly the same thing, except you put the swab someplace else. You can do it by having the patient defecate into a plastic hat type of appearance of a device, or you can have them bend over and use the swab. Frankly, bending over using the swab is better for the patient in the office setting, but in a nursing home or in an assisted living facility, it may not be the best way to do it. You can scrape it right off their bed sheets and get the same information, as it turns out. Wouldn't be the way I would do it, but it can be done. For urine analysis, it's the same thing. When urine gets cold, the bacteria die. Wouldn't you know it? Okay, so lots and lots of urine cultures come back negative simply by virtue of the fact that the samples are handled poorly. With DNA analysis, the best sample handling is to get it to the lab within 3 days. If you put it on ice, it's good for a week or more. So there's no limit with regards to the distance. But the data is spectacular. We can look at 3-4 different types of parainfluenza, which is kind of interesting, isn't it? Somebody comes in with an upper respiratory infection. They're convinced it's flu because they feel so bad. Oddly enough, rhinovirus will make you feel equally ill, but wouldn't you know it, the treatment is very, very different. How many patients come in with strep, or they think they have strep, and you do one of those little cultures, a little swab for the back of the throat, instant analysis? They're wrong about a third of the time. This is nonsense. In these days that you should not be dealing with these sorts of inaccuracies. Why treat somebody for strep throat when they have mono? Why treat somebody for a urinary tract infection when they don't have one? Why deal with somebody with infectious diarrhea that really has a foodborne problem like staph? Okay, it doesn't make a lot of sense to be throwing antibiotics at people and creating issues like Clostridium difficile, C. difficile to some of you. Okay, it does not make any sense. MRSA wasn't around until we went ahead and mistreated our patients. That is the compelling message here. So at Florida Laboratory Analysis, we are one of the few labs in the country that can do this for your patients and do it reasonably, do it conveniently. The data is there. All you need to do is learn how and when, why. It's got to be done. So you're sitting in a nursing home. Okay, you have 30 patients on your ward. One of them ends up with MRSA. Okay, don't you think it might be kind of interesting to find out whether or not it is MRSA? You think it's MRSA. Okay, good thing to know for certain. What about the patient next door? You really want to know the next time they come up with a sore what the bug is and how to treat it. That is what this is all about. Somebody comes in with an upper respiratory tract infection. If it's rhinovirus, guess what? You treat these individuals differently than if it's influenza. That is the nature of the game. That's what we have to offer you, and that's what Florida Laboratory Analysis is all about.